Right now, millions of people over 60 are eating what they believe is the perfect heart-healthy snack. They've been told bananas prevent heart attacks, lower blood pressure, and protect against stroke. But what almost nobody knows is that when you combine this so-called superfood with 4 specific common foods, you're creating a biochemical reaction in your cardiovascular system that can trigger dangerous heart rhythm disturbances, catastrophic potassium imbalances, and yes, even heart attack within hours of eating. This isn't about moderation. This isn't about portion control. This is about food combinations that fundamentally alter how your heart's electrical system functions, and by the end of this video you'll understand exactly which combinations are putting you at risk and what you need to do starting with your very next meal. Before we go further, if you're experiencing severe chest pain, sudden shortness of breath, pain radiating to your jaw or left arm, or profuse sweating, stop watching and call emergency services immediately. What we're discussing today is prevention and education, not emergency treatment. Now, if you want to take control of your heart health with information your doctor probably hasn't told you, hit that subscribe button right now, because this channel exists to give you the medical truth that conventional healthcare often overlooks. Here's what makes this situation so dangerous. Bananas contain approximately 420 to 450 milligrams of potassium per medium fruit. Your heart depends on a precise potassium to sodium ratio in your bloodstream to maintain normal electrical conduction. When that ratio shifts even 15 to 20% outside normal parameters, your heart's sinoatrial node, the natural pacemaker located in the upper right chamber of your heart, begins misfiring. This causes arrhythmias, irregular heartbeats that can range from harmless palpitations to life-threatening ventricular fibrillation. The 4 food combinations we're about to discuss don't just add potassium, they create synergistic effects that amplify potassium absorption, block potassium excretion through your kidneys, or trigger massive potassium release from your cells into your bloodstream simultaneously. Let me share what happened to Robert, a 68-year-old retired accountant who came into the emergency department at 7:45 on a Tuesday morning. Robert had eaten his usual breakfast, a banana with his oatmeal, a glass of orange juice, his prescribed ACE inhibitor for blood pressure, and a potassium supplement his wife had bought at the health food store. Within 90 minutes, he experienced severe heart palpitations, weakness in his arms and legs, and a sensation he described as his heart stopping and starting. His potassium level measured 6.8 milliequivalents per liter. Normal range is 3.5 to 5.0. At 6.5, you risk cardiac arrest. Robert survived, but he had no idea he'd created a perfect storm of hyperkalemia, dangerously elevated potassium levels, through a combination millions of seniors eat every single day. The first dangerous combination is bananas with ACE inhibitors or ARBs, the most commonly prescribed blood pressure medications in patients over 65. These drugs include lisinopril, enalapril, losartan, and valsartan. Here's the mechanism your doctor may not have explained. Your kidneys normally excrete excess potassium through a complex process regulated by aldosterone, a hormone produced by your adrenal glands. ACE inhibitors and ARBs suppress aldosterone production as part of how they lower blood pressure. This suppression reduces your kidney's ability to eliminate potassium by approximately 30 to 40%. When you eat a banana containing 450 milligrams of potassium while taking these medications, your body cannot process and excrete that potassium efficiently. Each banana you eat creates a cumulative effect. One banana might raise your serum potassium by 0.3 milliequivalents per liter. 2 bananas daily while on these medications can elevate levels by 0.7 to 0.9 milliequivalents per liter. Within 1 week, you've moved from normal range into the danger zone. Saudasin that sastingni. But the risk multiplies exponentially if you're also dealing with even mild kidney dysfunction, which affects approximately 40% of adults over 70. Your glomerular filtration rate, the measure of how efficiently your kidneys filter waste, naturally declines about 1% per year after age 40. If your GFR has dropped from 100 milliliters per minute to 60, you've lost 40% of your kidney filtering capacity. Combine reduced kidney function with ACE inhibitor-induced aldosterone suppression and regular banana consumption, and you're creating conditions for hyperkalemia that can develop within days, not months. The second dangerous combination is bananas with potassium-sparing diuretics, specifically spironolactone, amiloride, and triamterene. These medications are frequently prescribed alongside other blood pressure drugs or for heart failure management. The name tells you exactly what they do. They help your body eliminate excess fluid and sodium while sparing or retaining potassium. If you're taking 25 milligrams of spironolactone daily, your kidneys are already holding on to approximately 300 to 400 milligrams more potassium per day than they would naturally excrete. Now add 1 medium banana with 450 milligrams of potassium. Your body receives nearly 850 milligrams of potassium it cannot eliminate efficiently. The result is a steady, dangerous climb in serum potassium levels that often produces no symptoms until levels reach critical thresholds. Here's what makes this combination particularly insidious. Potassium-sparing diuretics are often prescribed in combination pills with other diuretics. You might be taking hydrochlorothiazide with triamterene, marketed under names like Diazide or Maxide, and not even realize one component is potassium sparing. You eat bananas thinking you're supporting heart health, completely unaware you're undermining the careful electrolyte balance these medications are designed to maintain. I've seen patients whose potassium levels climbed from 4.2 to 6.1 in just 3 weeks of eating 1 banana daily while on these medications. At 6.1, you're at imminent risk of cardiac arrhythmia. The third dangerous combination involves bananas with non-steroidal anti-inflammatory drugs, particularly when used regularly for chronic pain conditions. Medications like ibuprofen, naproxen, and prescription NSAIDs such as meloxicam affect your kidneys through a completely different mechanism than blood pressure medications, but the result is identical: reduced potassium excretion. NSAIDs work by inhibiting cyclooxygenase enzymes, which reduces prostaglandin production. Prostaglandins, among many functions, help regulate blood flow to your kidneys. When NSAID reduces renal blood flow by 15 to 25%, your kidney's ability to filter and excrete potassium drops proportionally. If you're taking 400 milligrams of ibuprofen 3 times daily for arthritis pain and eating a banana each morning, you're creating a dual assault on your potassium regulation system. The NSAID reduces your kidney's filtering capacity. The banana provides a potassium load your compromised kidneys cannot handle. Over weeks and months, this combination steadily pushes your potassium levels upward. The danger intensifies if you're also taking blood pressure medication, which nearly 70% of NSAID users over 65 are. Now you have 3 factors: NSAID-reduced kidney function, medication-induced potassium retention, and dietary potassium intake, all converging to create hyperkalemia risk that conventional medicine rarely discusses until it becomes a crisis. The fourth and perhaps most surprising dangerous combination is bananas with certain potassium supplements and salt substitutes. This seems obvious, but the reality is far more complex and dangerous than simple addition. Many seniors use salt substitutes containing potassium chloride instead of sodium chloride, believing they're protecting their hearts by reducing sodium intake. Products like New Salt, No Salt, and various low-sodium seasoning blends can contain 600 to 1300 milligrams of potassium per quarter teaspoon. If you're sprinkling this on your food throughout the day, you could be consuming 2,000 to 3,000 milligrams of potassium from salt substitute alone. Add a banana with 450 milligrams, and you've exceeded safe potassium intake limits even without considering the potassium in other foods like potatoes, tomatoes, spinach, and orange juice. But here's the critical factor almost nobody understands. Potassium chloride from supplements and salt substitutes is absorbed differently and more rapidly than potassium from whole foods. The potassium in a banana is bound within cellular structures and fiber, which slows absorption. The potassium chloride in a salt substitute is immediately bioavailable, hitting your bloodstream within 30 to 60 minutes of consumption. When you combine rapid absorption potassium from supplements with whole food potassium from bananas, you create acute spikes in serum potassium that can trigger immediate cardiac symptoms, palpitations, chest discomfort, and in severe cases, sudden cardiac arrest. I treated Margaret, a 72-year-old woman with well-controlled hypertension who experienced severe weakness and heart palpitations after switching to a salt substitute on her doctor's recommendation to reduce sodium. She was also eating a banana with breakfast and another as an afternoon snack, believing she was following heart-healthy dietary advice. Ning dir descendien. Her potassium level measured 6.4 milliequivalents per liter. She required emergency IV treatment with calcium gluconate to stabilize her heart's electrical activity, insulin and glucose to drive potassium back into her cells, and a binding resin to remove excess potassium from her digestive system. All because she was following advice she thought would protect her heart. Now, let's address what your conventional doctor isn't telling you about these combinations, and why this information rarely reaches patients until after a crisis. The standard medical approach treats potassium levels as a laboratory value to be monitored, not a dietary factor to be carefully managed through specific food combinations and medication awareness. Your doctor prescribes an ACE inhibitor and might mention avoiding excessive potassium, but rarely provides the specific guidance you need. Exactly which foods to avoid, which combinations create danger, and what symptoms signal developing hyperkalemia before it becomes life-threatening. The medical system assumes you'll have regular blood work monitoring potassium levels, but here's the reality. Most patients on blood pressure medication have comprehensive metabolic panels every 3 to 6 months, not every week. Hyperkalemia can develop in days under the right circumstances. By the time your quarterly blood test reveals elevated potassium, you might have been in the danger zone for 8 to 10 weeks. During that time, your heart has been subjected to sustained electrical stress that increases risk for arrhythmias, reduces cardiac output efficiency, and can cause permanent changes to heart muscle cells if the imbalance persists long enough. Furthermore, conventional medicine focuses almost exclusively on preventing hypokalemia, low potassium levels, particularly in patients taking standard diuretics like furosemide. The messaging has been so focused on ensuring adequate potassium that the opposite danger, hyperkalemia, gets far less attention in patient education. Doctors tell patients to eat bananas to prevent potassium depletion from diuretics, but they fail to account for patients who are simultaneously taking potassium-retaining medications or supplements that completely reverse that equation. Here's what you need to understand about the symptoms of developing hyperkalemia, because recognizing these early can prevent progression to dangerous levels. The earliest symptoms are often subtle: unusual fatigue, muscle weakness, particularly in your arms and legs, tingling sensations around your mouth or in your extremities, and nausea. These symptoms are non-specific, meaning they could indicate dozens of different conditions, which is exactly why hyperkalemia often goes unrecognized until levels become critical. As potassium continues rising, you might experience slow or irregular heartbeat, chest discomfort that feels different from typical angina, and severe weakness that makes even simple activities like climbing stairs or lifting objects difficult. At dangerous levels above 6.5 milliequivalents per liter, you risk sudden cardiac arrest with little to no warning. So what's the solution? How do you protect yourself while still maintaining adequate potassium intake for heart health? The answer requires a systematic approach based on your specific medication profile, kidney function, and overall cardiovascular risk. First, if you're taking ACE inhibitors, ARBs, potassium-sparing diuretics, or using NSAIDs regularly, you need to eliminate the routine daily banana habit. This doesn't mean you can never eat a banana, but it means you cannot treat it as a daily staple food. Instead, limit banana consumption to no more than 2 to 3 times per week, and when you do eat a banana, make it a half portion, not a full medium fruit. That reduces potassium intake from 450 milligrams to approximately 225 milligrams per serving, a level most medication regimens can accommodate without creating dangerous accumulation. Second, you must eliminate all potassium chloride salt substitutes immediately if you're on any of the medications we've discussed. This is non-negotiable. The rapid absorption rate combined with medication effects creates too great a risk for acute hyperkalemia. If you need to reduce sodium for blood pressure management, use herbs, spices, garlic, onion powder, and lemon juice for flavoring instead. These provide taste enhancement without adding either sodium or dangerous levels of potassium. Third, schedule a comprehensive metabolic panel with your doctor specifically to assess your current potassium level, kidney function measured by GFR and creatinine, and baseline electrolyte status. This gives you a starting point. If your potassium is already trending high normal, say 4.7 to 4.9 milliequivalents per liter, you have very little room for dietary potassium before reaching dangerous territory. If your GFR is below 60 milliliters per minute, indicating stage 3 chronic kidney disease, you need to be even more restrictive with high potassium foods across the board, not just bananas. Fourth, review every supplement you're taking with specific attention to potassium content. Many multivitamins contain 90 to 100 milligrams of potassium per serving. Electrolyte replacement drinks can contain 200 to 400 milligrams per serving. Certain herbal supplements affect potassium regulation indirectly. Make a complete list of everything you take, including over-the-counter medications, and review it with your pharmacist, specifically asking about potassium content and interactions with your prescription medications. Fifth, understand the other high potassium foods that create similar risks when combined with the wrong medications. Orange juice contains approximately 450 milligrams per 8-ounce serving. Potatoes contain 600 to 900 milligrams depending on size and preparation. Tomato products including sauce and paste contain 300 to 500 milligrams per half cup, and spinach contains 420 milligrams per half cup cooked. You don't need to eliminate these foods entirely, but you need to track total daily potassium intake if you're on potassium-retaining medications. Your target should be between 2,000 to 3,000 milligrams total per day from all sources combined, not the general population recommendation of 4,700 milligrams. Sixth, request more frequent potassium monitoring if you're on multiple medications affecting potassium balance. Instead of quarterly testing, ask for monthly comprehensive metabolic panels for the first 3 months after any medication change, then every 6 weeks if levels remain stable. This catches developing hyperkalemia before it becomes dangerous and allows for dietary or medication adjustments before you experience symptoms. Seventh, learn to recognize your personal early warning signs. Everyone's body responds slightly differently to electrolyte imbalances. doses. Pay attention to patterns. Do you feel more fatigued on days when you've eaten high potassium foods? Do you notice muscle weakness or tingling after certain meals? These subtle signals are your body's early warning system. Don't dismiss them as normal aging or stress. Document them and discuss patterns with your doctor. Now, let's talk about what you should eat instead of bananas for heart health and potassium balance. Din din stat nou de satmins. Apples provide excellent cardiovascular benefits through quercetin and fiber with only 195 milligrams of potassium per medium fruit. Berries, including blueberries, strawberries, and raspberries, offer powerful antioxidants with 100 to 160 milligrams of potassium per cup. Grapes contain approximately 175 milligrams per cup with beneficial resveratrol for heart protection. These fruits provide heart-healthy nutrients without the potassium load that becomes dangerous when combined with certain medications. For those concerned about maintaining adequate potassium for heart health while on these medications, understand that the body is remarkably efficient at maintaining potassium balance when kidney function is normal and medication effects are considered in dietary planning. You don't need massive potassium intake. You need consistent, moderate intake from varied sources that your body can process efficiently given your medication regimen. Let me give you a practical daily eating framework if you're on ACE inhibitors, ARBs, or potassium-sparing diuretics. Breakfast: 1 cup of berries with Greek yogurt, avoiding orange juice and bananas. Mid-morning snack: an apple or small handful of grapes. Lunch: mixed green salad with chicken, avoiding heavy tomato-based dressings, with moderate portions of vegetables. Afternoon snack: vegetables like carrots or cucumbers with hummus, which contain low potassium levels. Dinner: lean protein with moderate portions of vegetables, choosing lower potassium options like green beans, cauliflower, or cabbage instead of potatoes, sweet potatoes, or winter squash. This pattern keeps total daily potassium between 2,200 to 2,800 milligrams, safely within limits for most medication regimens while still providing adequate nutrition. If you're taking NSAIDs regularly and cannot discontinue due to chronic pain conditions, you need to be even more vigilant. NSAIDs should ideally be used at the lowest effective dose for the shortest duration possible, but for chronic conditions like severe arthritis, that's not always realistic. In these cases, work with your doctor to ensure kidney function is monitored every 3 months minimum. Request a urinalysis along with blood work to detect early signs of NSAID-related kidney damage before it progresses. Consider alternative pain management strategies including physical therapy, topical anti-inflammatory preparations like diclofenac gel, which has minimal systemic absorption, acetaminophen, which doesn't affect kidney function or potassium balance, and for appropriate candidates, carefully monitored low-dose opioid therapy, which carries its own risks but doesn't affect potassium regulation. For those using potassium supplements, because they were prescribed years ago and have continued taking them out of habit, it's time for a comprehensive medication review. Many patients were started on potassium supplements when taking standard diuretics that deplete potassium, but then had medication changes adding ACE inhibitors or other drugs that retain potassium. The supplement that was once necessary becomes dangerous, but nobody reviews the complete medication list to catch this contradiction. Schedule an appointment specifically for medication reconciliation. Bring every pill bottle, supplement, and over-the-counter product you take. Ask your doctor or pharmacist to review everything for interactions, duplications, and medications that may no longer be necessary given your current regimen. Now here's what I want you to do in the next 24 hours. First, check every medication you're currently taking against this list. ACE inhibitors, including lisinopril, enalapril, ramipril, benazepril. ARBs, including losartan, valsartan, irbesartan, candesartan. Potassium-sparing diuretics, including spironolactone, amiloride, triamterene, and combination products containing these. NSAIDs, including ibuprofen, naproxen, meloxicam, celecoxib, and any prescription anti-inflammatory. If you're taking any of these medications, you're in the at-risk category for the combinations we've discussed today. Second, go through your kitchen right now and identify all potassium-containing supplements, electrolyte drinks, and salt substitutes. Read every label carefully. If you're on any of the medications listed above and you have salt substitutes containing potassium chloride, throw them away today, not tomorrow, not next week. Today, the risk is too great. Third, schedule that comprehensive metabolic panel if you haven't had one in the last 60 days and you're on any potassium-affecting medications. When you call for the appointment, specifically tell the scheduler you need CMP to check potassium levels and kidney function. This ensures the correct tests are ordered. Fourth, calculate your typical daily potassium intake for the next 3 days. Use an online nutrition database or app to track everything you eat and drinks. You might be shocked to discover you're consuming 5,000 to 6,000 milligrams daily, far above safe levels if you're on potassium-retaining medications. This awareness alone can prevent dangerous accumulation. If you're watching this and you recognize you've been eating bananas daily while taking one or more of these medications and you haven't experienced symptoms, that doesn't mean you're safe. Natin natin monitorings, datim nirstaunda mats. Hyperkalemia can develop gradually with potassium levels creeping upward over weeks and months before reaching the threshold that produces noticeable symptoms. The absence of symptoms today doesn't guarantee normal potassium levels. It means you haven't reached the critical threshold yet. But every day you continue these dangerous combinations, you move closer to that line. For those of you who are watching and thinking this is overly cautious or fear-mongering, I want to share the hard medical reality. Hyperkalemia is directly responsible for approximately 2,000 to 5,000 deaths annually in the United States, with the vast majority occurring in patients over 65 taking the exact medications we've discussed. The actual number is likely far higher because hyperkalemia-induced cardiac arrest is often attributed to heart attack or sudden cardiac death without deeper investigation into the underlying electrolyte disturbance that triggered the event. This is preventable. Every single case of diet-induced hyperkalemia is preventable through the information I've shared today. Let me be absolutely clear about one final critical point. This is not medical advice for your specific situation. I don't know your complete medical history, your exact medication regimen, your kidney function status, or your individual risk factors. What I've provided today is educational information about dangerous food-drug interactions that affect millions of seniors but receive far too little attention in conventional medical practice. You must work with your own healthcare provider to apply this information to your specific circumstances. Schedule that appointment, have that conversation, request those tests. Take control of your cardiovascular health through knowledge and partnership with your medical team, not passive acceptance of generic dietary advice that may be directly contradicted by your medication regimen. If you found this information potentially life-saving, share it with someone you care about who might be at risk. Post it in your community groups. Send it to family members taking blood pressure medication. This is information that saves lives, but only if it reaches the people who need it most. And if you want to continue getting medical truth that empowers you to make informed decisions about your health, subscribe to this channel right now and hit that notification bell so you never miss content that could protect you and your loved ones. Drop a comment below telling me your age and whether you're taking any of the medications we discussed today. This helps me understand who's watching and what content serves you best. Remember, your heart doesn't care about good intentions. It responds to the biochemical reality of what you put in your body and which medications are altering your physiology. Protect yourself through knowledge, vigilance, and proactive management of these dangerous combinations starting today.